Today we're talking about a common but often overlooked foot condition that affects millions of people, bunions. While many suffer in silence, assuming surgery is their only option, there's exciting news in the world of podiatry. We're joined this morning by Dr. Brad Abicht, a local expert from Amplify in La Crosse, who's pioneering a minimally invasive procedure that's changing lives. Dr. Abicht, welcome to Mindful Monday. Good morning.
Thanks so much for having me.
Yeah, we're happy to have you. So first, some people may have personal experience, some people may not. For people who don't have that experience, what is a bunion and why is it so painful?
Yeah, bunions are very common conditions that we see. If you look at the word bunion, it's actually derived from the Latin root meaning turnip, because some people think it's a giant turnip on the side of your big toe joint. But for us or for patients, bunions are known as a large painful bump on the side of their big toe joint or at the base of their big toe. For surgeons, we know it as a little bit more of a complex deformity, typically involving a three-dimensional deformity at the great toe joint, where the big toe is in malalignment with the big toe joint, and the first metatarsal bone is actually pushing against the skin, causing pain. And when you combine that with narrow shoe gear and weight-bearing activity, that can create a painful and dysfunctional situation for a patient.
Sounds painful for sure.
Yeah, so tell me, why don't people address their bunions? I mean, and why? What are the risks of leaving them untreated?
Yeah, it's a great question. I think for most patients, they're going to try and ignore their bunion as much as they can, and maybe even when that bunion is in its very early stages, it's not quite as painful or symptomatic yet for them. And notoriously, bunion surgery is a painful process. With traditional open bunion surgery, it's a slow recovery. Everybody's busy, so it's not really ideal timing to ever have foot surgery. But these new minimally invasive procedures have made it much easier for patients. But if that bunion is left untreated, it can progress. The bunion can get bigger itself. It can become more painful. Some people develop arthritis. And in some severe situations, you can actually develop an open sore that is at risk then for infection or other complications.
Yeah, you're kind of preaching to the choir here, by the way. I have two of them, and I have screws in each foot as well. So yeah.
All right, get your feet up on the table.
You don't want to see that. No one wants to see that. It's a painful event. So,
Yes. He does talk about the discomfort a lot. So you do perform this minimally invasive bunionectomy. What can you tell us about that and how it differs from the traditional one you were talking about?
Yeah, so in most traditional open bunion surgeries, there is a larger incision that is made, which requires pretty extensive dissection around the bone and the joint in order to correct the bunion. If you contrast that with the minimally invasive approach, we're able to correct the bunion through tiny little poke hole type incisions, or what we call percutaneous incisions. This allows us to preserve the skin and the soft tissues around the bone, which typically results in much less pain for the patient. And although there's a number of benefits, a couple that I would highlight would be significantly less pain, the ability to walk on your foot right away after surgery, which is a big deal for a lot of patients. There's less joint stiffness and scarring that develops. The scars are a little more cosmetically appealing to patients, as well as just overall a quicker recovery in terms of returning to regular shoe gear, your daily activities, maybe even your job or employment, or even athletics.
Yeah, all very important parts.
No more bone breaking?
It does still involve a reconstructive procedure to realign the bone, but again, it's done through these minimally invasive approaches.
Wow,
okay, yeah, we were seeing some pictures there of that. And then quickly before we go, if someone does have a bunion or they think they have a bunion, what should their first step be?
Yeah, I think just coming in to have it evaluated, really. And I think it's important to recognize that not all surgeons do this approach. So, if you've seen someone for your bunion, you may want to look into another opinion for that to see if you're a candidate for it. But otherwise, if you haven't seen anybody, I'd encourage you to set up an appointment with me at Amplify Health here in Gunderson, in La Crosse, as well as, we'll take some x-rays and review those for you and have a discussion on whether or not you might be a good candidate for minimally invasive bunion surgery.
Okay, all right, great to know, doctor. Well, thank you so much for being here this morning.
Yeah, thank you, appreciate it.
Stay with us, we're back right after this.